Good afternoon and welcome. My name is Tim Poe. I'm Director of Telehealth with the UNC Cancer Network. Thank you so much for being here today as we talk about stress management in everyday living. Let me make sure that all of our systems are unmuted. Again, we'll be talking about stress management in everyday living. We're going to start out by previewing our Poll Everywhere question. Our first question is, what stressors are you currently experiencing? So think about any stressors that you're currently experiencing, and then you can go ahead and send those in to us. The easiest way to do that is you text to the number 22333, the letters UNCCN. So if you're using a smartphone, you can just text, or even not a smartphone, you can go ahead and text the numbers 22333. And at that, you're going to send the letters UNCCN. Once you've done that once, then you can go ahead and type in any stressors you're currently experiencing, and then we'll see those on the big screen, and you'll see those as well in just a moment. All right, our presenters today, I'll go ahead and move this so that we can see our full group here. We have Kelly Morelli and Kelly Kivett with us. Kelly Morelli, LTR, CTRS, BCB, recreational therapist with the oncology unit at the North Carolina Cancer Hospital. Kelly initially completed a year-long clinical fellowship as a recreational therapist in 2003. After completion, she became a full-time employee in psychiatry, providing services in both an individual and a group setting. She later transitioned to the inpatient oncology unit, where she has been for the past 4 years. She utilizes multiple interventions to aid patients in managing stress with new diagnoses and their treatment process. Kelly is board certified in biofeedback and uses applications to help patients increase self-awareness of stress and stress response while emphasizing healthy everyday solutions and coping skill use. Kelly enjoys time with her partner and 3-year-old girl. Spending time with her family outdoors is her favorite way to re-energize. So we already know one of the ways that you cope with stress, Kelly. And we have another Kelly with us, Kelly Kivett. Kelly, LRT, and CTRS, recreational therapist, bone marrow and stem transplant program at University of North Carolina at Chapel Hill. And Kelly, for the past 17 years, has been the primary recreational therapist on the bone marrow transplant unit at UNC hospitals. During this time, Kelly has had the opportunity to work with pediatric and adult BMT patients. She emphasizes patient and family-centered care, helping these individuals develop healthy coping skills and strategies for managing the stressors associated with the diagnosis and treatment. Outside of work, Kelly enjoys spending time with her family, which includes 2 active little boys. She and her husband both graduated from East Carolina University before they settled in Pittsboro, North Carolina to raise a family. Kelly, welcome to you as well. Thank you. Let's take a look at that poll and see if we've got anything back. And while we're waiting, if each of you could tell me a little bit about what was your interest in stress management? And so Kelly Kivett, I'll start with you.
Sure. Well, I think, as you mentioned, I've been on the bone marrow unit for about 17 years now, and so I see firsthand on a daily basis the stressors that many of our patients encounter, and also the caregivers for these patients. So I'm acutely aware each day of some of the things that they encounter, and I'm fortunately in a role where I do work to help them with identifying the coping techniques and ways to manage that stress while they're going through treatment.
Great, thank you. And Kelly Morelli?
I'd have to kind of echo what Kelly has mentioned, and we look at oftentimes the patients that do come into our hospital have already experienced stress and mismanagement of stress. And so once they're here in the hospital, that's amplified in lots of different ways. And so with full disclosure, though, Tim, we have to say that while we teach and implement different techniques to help people find ways to manage stress, we're not always the most perfect at it. So we still are fighting that journey there. So.
Absolutely. And I think, that's one of the things about stress. It's something we all experience, and so I'm sure everyone here today can benefit from the lessons that you're going to provide. Let's take a look at that survey, and we'll see if anyone's responded to that. Reminder, you can also go to pollev.com/UNCCN and respond there as well. But if you take just a moment to anything that you're currently experiencing in terms of stress. And you can just text the letters UNCCN to the number 22333. Nice thing about doing that, we're going to ask some other poll questions a little later this afternoon. And so once you do that, UNCCN to the number 22333 one time, then you can go ahead and submit other poll answers, and we'll receive those as well. So, and UNCCN, okay. Oh, good. I'm glad. I was worried for a minute that UNC Cancer Network was stressing you out. I'm glad to hear that's not the case. New job. A new job can absolutely be a stressor.
Absolutely. Oh,
another one, new jobs.
Yeah.
Well, congratulations
Yeah,
on the new
really.
jobs.
Finances.
Think we can relate to that one. Cost of insurance. Absolutely. Absolutely. Of course, one of the things about stressors is both positive and negative aspects of our life can be stressors.
Absolutely. We can probably add some more to that list if they're I have plenty of my own that we can talk about.
Presenting an online webinar?
Yeah.
Back to school.
Okay.
Yeah.
All right. Going back to school. Very good.
Moving.
Okay. Time management.
Oh,
Yeah. These are great.
This is terrific. Thank you all so much for sharing those with us. And again, I mentioned we'll have at least two more opportunities during this presentation to share more. Oh, wedding planning. Yeah.
That's an exciting one.
That's an exciting one, but also can be very stressful. So,
Absolutely.
Okay. All right. Well, without further ado, we'll move into our presentation. And who should I pass this to first?
You know, Kelly, we always joke, but Kelly is older and wiser.
True story.
So she's going to be in charge of that.
Mm-hmm.
And she can multitask a lot differently than myself.
Yes. All right. So our goal today is really just to help you all understand what stress looks like and know that it does affect different people different ways. What impact does it have on you and your immune system, and what are some things that you might be able to do to help manage that stress? So with that being said, we'll sort of jump into, what stress is and what that looks like for each of us. So when looking up definitions of stress, you will find multiple definitions, really. But one of the ones that you see most often is that stress is the nonspecific response of the body to any demand for change. And so when you think about that, that's really a very general, sort of generic definition, but I think it speaks to stress in that everybody really experiences it in a different way. So everyone's triggers are different, everyone's response is different. Stress can also be seen as a state of just mental or emotional strain resulting from an adverse circumstance, and that circumstance can certainly vary as well. It could be something as simple as waking up late, getting stuck in traffic, or to something, a lot more serious, struggles, marital issues, or obviously a cancer diagnosis. So, certainly our stressors, as I said, by definition, are those life events that cause the stress. And as I just mentioned, they can be very mild, or they can be, as I said, something as serious as a serious diagnosis.
Sure. We look at different words, too, that we can consider for stress. For example, worry and anxiety, bodily or mental tension. We think about strain or overwork when you consider stress. And then any kind of mental or emotional disruption. And just as a fun side note, if you spell stressed backwards, you get the word deserts. But both have very different emotional responses to most people. As we said earlier, everybody has some type of stress in their life. It's very normal for all of us to experience stress on a regular basis, no matter what's going on in our life. And there are different types of stress that we experience. Eustress is positive stress that we experience, and usually this is a good thing because it often generates change or generates us to sort of make a difference in what's going on in our life. And some of those things that you put up on the screen, the wedding plans, the new job, obviously there's some stress involved with that, but likely it's causing you to make a difference in what's going on. Distress is the type of stress that is most commonly referred to and associated with things that are more serious, if you're having various issues going on in your life, especially a new diagnosis of cancer. I think one important thing to point out is that chronic stress over a period of time will suppress our immune system, which in turn makes us a lot more vulnerable to additional stressors and additional disease if
that should occur.
Yeah, and one of the things that's very interesting to know about unchecked stress is that prolonged experiences with stress releases a hormone cortisol, which many of you may be familiar with, which can reduce levels of serotonin and dopamine, which are linked to depression. So there's lots of different things to consider about long-term chronic stress if left unmanaged.
Some of the, I guess, psychological effects of exactly what you were just talking about would include like anxiety, depression, difficulty sleeping, and things like that. And then some of the physiological effects that can come from that increase in cortisol could be, increased blood pressure, digestion issues, and things of that nature. All right. So before we move into that, I guess we can also just talk about a few facts that we came across when doing some more additional research for the stress talk today.
So it's also important to be able to kind of look at some of these as part of an experience that you have with stress. And some of these might surprise you, but they certainly didn't surprise us in some instances for our own personal experiences with stress. So let's look at one of the first facts is that your body doesn't care if it's a big stress or a little stress. As Kelly has mentioned previously, if you have just started a new job, that's maybe a positive stressor, but if you're in traffic and you get pulled out, someone pulls out in front of you in traffic, and then versus that of being receiving a new diagnosis, your body responds the same way, and you have about 1,400 chemicals that go through your body when you're under stress. So your body does not discriminate to what the stressor or the event is. It's still going to respond the same way, whether it's a big stress or a little stress. So understanding that it doesn't care, your body doesn't care what it is really important for looking at how we manage it. A lot of people will wait until big stressors come up and then think, oh, I really need to find a way to manage these things. But it can be the everyday buildup of little stressors that are compounding and creating these same impacts on our system.
So another fact to point out is that stress can make really smart people do really stupid things sometimes. So our brain doesn't process things the same way when we are under extreme stress. And so I'm sure you can all think of a time when you've been really upset with someone, had an argument, and probably said or done some things that, looking back in hindsight, you really wished wouldn't have happened. And so that's the direct result of the stress impact on our systems.
Yeah, I'm owning that one.
Absolutely.
Great. All right. People can become numb to their stress, and we'll look at some of these symptoms. If you haven't already, we'll review some of those. But people can become numb to those things, and oftentimes stress can accumulate pretty quickly in our lives. And if we're experiencing that chronically, we may not even be aware that we're stressed. I can't speak to how many times we've asked patients and even caretakers what kind of experiences they were having with stress. And a lot of people will say, oh, I'm not stressed. And then when you get into the details of their experience, well, they've got into a space where they are not aware of it because it's become such a normal experience in their day-to-day life.
A good thing about stress is that we do have some control in how we choose to respond to the stress in our life. If we can basically increase our awareness of how stress impacts us and what we personally can do to change that, it can make a big impact on our body's response. So the identification of healthy coping techniques and healthy coping strategies, and then the implementation of those strategies can make a big difference in the stress that we experience.
That's great. And the best strategy to handling stress is in the moment. And we oftentimes will do a kind of binge purge of our stress symptoms. So we'll let it build up during the day, and then, this afternoon I'm going to go work out at the gym, so I'll take care of it then. Or I may meditate in the morning and get myself prepped. But it's in those moments, to minute stressors that come up throughout our days that can oftentimes be a great point for us to take a moment and utilize techniques that we might learn here today, but things that you're already using, so that they don't build up towards the end, because it's still going to impact our body the same way. So best way for doing that is in the moment when we're able to.
So hopefully you all had a chance to look at the stress symptom checklist. I think that these guys attached it to, to the link that you're seeing, but it's going to pop up here in just a minute also on your screen. But I think one thing about it is that often we don't realize that we are stressed until stress exhaustion symptoms begin to manifest and present themselves to us. So as you can see on the board here, stress can affect us physically, It can affect our social life, it can affect emotionally, cognitively, how we're thinking about things, our leisure lifestyle, or our motivation to engage in leisure, and also our spiritual life.
And again, as we mentioned, prolonged experience of unchecked stress can really impact our nervous system and long-term health issues and concerns. There's a plethora of information and lots of different sites that will give us information about research that really connects stress and its effects long-term on health conditions.
Jump ahead to the screen.
Yeah.
Let's see.
Let's try that. Yeah.
Let's see. I think our stress checklist actually is going to pop up after the screen. So I'm going to forward so you can talk about that a little
Great. So this is a nice checklist just to review. If you haven't had a chance to look at it prior to this session, that's okay. You can utilize it another time. But what it does allow us to do is to become aware of the symptoms we're experiencing, because we can't learn to manage our stress if we're not aware of it. And there's quite a bit of symptoms here that you might find that are surprising to you. So if you are looking through the symptoms, you'll notice that they're delineated between different sections, different categories in our life. So we have the physical section of different symptoms you might experience. A lot of people will tell us about headaches and tension. People are sometimes surprised that they're accident prone more. Emotional, we have the different emotional experiences that people are pretty familiar with. Different spiritual impacts, as well as mental and relational. And all those pieces can combine to give us an overall experience of how stress has impacted us in different areas. But again, becoming aware of these symptoms can really empower you to become motivated and to find different ways to managing, because these are signs to ourselves to help us move forward and make different decisions to managing these things.
Thanks. So for anyone, obviously, who is diagnosed with cancer, who is caring for someone with cancer, or really who is even touched by cancer in any way, you certainly have an increased potential to experience stress in your life at that time. We've listed a few things that we often see as major stressors for folks, but certainly know that we understand this is not a limited list by any means. But one of the biggest things I often hear, that is causing stress for many individuals is just the fear of the unknown, and that can be so many different things. It can be, you may be feeling fear of, I don't even know what treatment protocol to choose, or, how is this going to impact me? What side effects am I going to have from this treatment? And even beyond that, how is my family going to do while I'm going through this? Are we going to have the financial means to care for this? So there's many, many things associated with that fear of the unknown.
Essentially, too, with separation from home and community, this could be physical separation from home and community, or it can be also emotional separation from home and community. When you're going through a big transition and diagnosis, oftentimes isolation, which we'll go to the next, can become a part of that. So, but then the other component would be moving physically away from home and community, and that can leave folks feeling distressed in those ways with their usual support people.
And in regards to isolation, that can also mean a couple different things. For many of the patients that we see, sometimes immune systems are suppressed, and so obviously they're not able to be out in the general community as much as they normally would be. Sometimes when inpatient in the hospital setting, sometimes they're on certain precautions that require that they stay confined to their room for a certain amount of time. So isolation, even emotionally, some people choose to isolate themselves just because of the fear of knowing how to interact or what to say to people. So be looked at differently.
Decreased independence, and then this is an interesting dynamic that we see, but certainly with fatigue and different experiences that you have with diagnosis and treatment process, a lot of independence may be lost. The other thing that can happen here is different role changes. So where we have a male that may be diagnosed with cancer or an illness, the wife now has to take on more responsibility for the finances, for the things at home that maybe the husband used to be primarily focused on. And so there's also that component that makes it very challenging for our patients oftentimes and for caregivers, because that can be very uncomfortable if you're used to having independence to managing those things, and now those things are not something that you can physically, emotionally, or mentally manage at this time with your treatment process.
The loss of control, I think, is another thing that we often hear about, and I know a lot of people tuned in today, I guess, are probably caregivers, so, it's also mindful, we need to be mindful of this as well, because sometimes, from a treatment team standpoint, the nurses, always having to check on, what's the urine output for today? What's this? Those sorts of things. And so for that, for someone who's been very independent for their entire life, having to kind of give up that control and let someone into that side of your life can be really challenging. So as as caregivers or as staff inside a hospital, these are things that we need to be mindful of, certainly on a daily basis when we think about the stress that these folks experience.
Really. And thinking too, considering being out of the hospital setting, change in daily routine can impact you at all different levels of your treatment process as a family or family caretaker. Routine may be changed and needs to be able to come to the hospital for different appointments, but your routine may be impacted by all sorts of different things: energy, lack of energy, inability to be around other people if you're immunocompromised. So all of those pieces are impacting not just here in the hospital, but also in the community in your home.
Absolutely. And of course, there are many others. Obviously, the fear of dying is certainly a very real concern for anyone, I think, who has a cancer diagnosis or caring for someone as well. And again, not limited to the things on this list, but these tend to be a lot of the ones that we hear or see most often in the hospital setting. So when someone is diagnosed with cancer, there's a multitude of feelings that one could potentially experience. There's shock, there's hurt, there's disbelief, but I think most importantly to recognize there is grief. And certainly our stress, is impacted by the grief that we experience. It also can impact our readiness to move forward with implementing healthy coping strategies.
It's important to recognize that these stages are not linear, and what that means is that you absolutely can be in one stage at one part and then jump down to a different stage and then back again. So it's not a linear process, and that's absolutely normal. And it's healthy to be aware of these, as Kelly's mentioned, because then it gives you some insight onto how to proceed with the best tools for managing that specific spot in your life.
I think we have is there another audience poll coming up here?
I do believe there is. Go ahead and advance that one more if you would.
Oh,
and there we go. And we'll see that. We'll see the question in just a moment here.
Okay.
Takes just hopefully we will. There we go.
All right.
Okay. What are you currently doing to manage your stress? So if you've already submitted a question, done that, submitting 22333 with the letters UNCCN once, you can just jump in and go ahead and do this now. So what are you currently doing to manage your stress? And great, we're seeing some coming in.
Good answers.
Yoga.
Exercise, yoga.
Yep.
Great.
Trying to get sleep. And just keep those coming in. I really like the way Alan set up our word cloud, so that this is a great way to display these.
And they can't see these. We can just.
What's that?
They can't see what's on the screen.
Oh, absolutely.
They can
yeah,
see.
yeah.
Okay.
They're seeing all of this right as
Okay.
we're seeing it. So
all right.
have life outside
Playing
of
piano. That's cool.
Perfect.
Mm-hmm.
You guys are coping very helpfully.
That's right. Well, I guess you don't need our session anymore.
Eating can be a stress reliever.
Yes.
Yeah. All right.
Perfect.
Music. Okay.
All really good answers. Absolutely. Thanks for sharing those. So, so we've talked a lot about stress and how stress can impact us. So now we're going to sort of move into the next half of our discussion today and just talk about some potential coping strategies. Know that, certainly this list is not exhaustive. There are many techniques that work differently for different people. The ones that we're going to share with you today are really the ones that we use most predominantly here in the hospital setting, because they are able to be used by patients who are here. Some of the things we'll discuss today include relaxation techniques. We'll talk about exercise, how that can be beneficial to aid with recovery and coping, social support, and then also creative expression.
Great. So we'll go ahead and transition into relaxation techniques. Well, I got to push the button.
There you go.
Great. I'll have to push it again. All right. So relaxation techniques is the state of being free from tension and anxiety. That's what we would term as kind of a relaxation state of being. And it is about giving your body and mind the space and opportunity to unwind and decompress. It's an attempt to kind of recharge your batteries in the best way possible for both mentally and physically to cope with your daily life challenges and even unexpected events.
All right, so there is continuously research being done on the potential benefits of using relaxation techniques. There's, as you can see, lots of physiological benefits listed with decreasing heart rate, decreasing your blood pressure, breath rate, muscle tension, but also helping to improve our concentration and our focus and our ability to self-manage our stress responses.
The thing that's really considered about relaxation techniques is that it also helps you become more resilient into managing the day-to-day stressors along with long-term effects. And so relaxing not only seems to delay the progression of disease, but it may be also something that helps us manage the recovery and speed that up as well. All right. There's several things for us to consider when we're thinking about utilizing relaxation techniques. And a lot of it has to do about openness and willingness to try these things. So the first question to really ask yourself is, are you willing to try new techniques? And there can be a lot of discomfort and vulnerability around utilizing techniques that you're not familiar with or comfortable with, or you may be pre-exposed to ideas about relaxation that you may not be comfortable with. So those are some things to evaluate. Can you create a quiet and uninterrupted, because I can't say that word, space? So that's another thing to consider. And not always do all the relaxation techniques have to be uninterrupted. Are you able to establish a routine? We know that routine can help us stay accountable to the things that are helpful to us in our lifestyle. Can you practice consistently? And then it's also thinking about what technique works best for you in the moment. And kind of considering your stress management skills like a toolbox. It's trying to figure out which tool works best for which scenario or situation. So which techniques work best for you and finding those skills and honing in on those as well.
So, how often do you pay attention to your breathing? We are very fortunate that our breathing is controlled by our autonomic nervous system, and it's something that our body just independently does. So, good thing we don't have to think about it on a regular basis. I don't think that we would get a whole lot done during the day if we had to be mindful of our breath from minute to minute. But the one thing that we do need to be aware of is how stress can impact our breathing. Mm-hmm. So oftentimes, whenever we have a stress response, we tend to start breathing a lot more shallow than we normally do, a lot faster than we rapidly do. Our body, in turn, begins to tense up, and some of those effects that we talked about earlier begin to happen to us. So what can we do to help that?
All right. Well, we have a term called diaphragmatic breathing, but this also might be known as abdominal breathing, belly breathing, deep breathing, and those are all techniques and terms that we've heard different ways. But in essence, it's looking at diaphragmatic breathing, which stimulates the parasympathetic nervous system. And when we stimulate the parasympathetic nervous system, we allow our body to do something called rest and digest. Stress, again, is releasing the cortisol effect, and if we were considering driving in our car and our gas in our life, or our gas in our system, is the sympathetic system. It is the thing that's in charge of activation. It is the flight or fight system, and when we put the brake on, that's the parasympathetic system. That's the thing that comes in and rebalances. It helps with rest and digest and slows down our system to get another recoup from the stress impact. So diaphragmatic breathing is the core essential building block to looking at ways to manage and engage that parasympathetic system. It relaxes the muscles. It also massages the internal organs. You may have mentioned those earlier. But it also allows us to have more oxygen in our system for managing the blood flow. Kelly's already mentioned that there is, that we typically find that when we're stressed, we have rapid breathing. If you've ever watched an infant sleep, what you'll notice is that the baby's belly is rising and falling in a natural rhythm. And over a course of time, when we become more stressed in our life, we become more thoracic breathers up here in our chest area. And so over time, that can impact us with the lack of oxygen that we can really get with our diaphragm use. So that's another thing to think about. It's also, again, a precursor for learning all the different relaxation techniques that we can utilize here forth. It's also free. It goes with you wherever you go, so it's another nice technique to use. And typically speaking, when you're thinking about diaphragmatic breathing, it's looking at about 6 to 8 breaths per minute. What that looks like is about 5 to 6 seconds in with the breath and out. So roughly 5 seconds in and out is a good model to have with those pieces.
All right. You guys have a chance to practice now.
Yeah, so we're going to get a chance to practice with some breathing techniques here. Oftentimes it's nice to have a cue so that you can find a way to follow your breathing pace. Many folks are not used to breathing this slow and this deep, so just know that when we're practicing this, that it might feel uncomfortable initially. If you start feeling lightheaded, please stop and return to your normal breathing rate. If you feel any pain or discomfort, again, stop. So let's give this a try. I'm going to be leading us through this. You should have a view on your screen with a breathing pacer. So yeah.
They have a breath pacer that they can see.
And right.
Perfect.
So you may want to leave your eyes open for this particular technique, but as the bar goes up, you're going to inhale, and as the bar goes down, you're going to exhale. If you place your right hand on your chest and your left hand on your belly, what you'd like to notice is that your right hand on your chest is not moving much, but mostly that breath is coming from your belly. So breathing in with the bar and out with the bar. Nice, deep and full breaths in and exhaling completely and fully. If you attempt to breathe in through your nose, that warms the air, and as you exhale, if you can do that through pursed lips, you slow that exhalation, which engages the parasympathetic nervous system. So the longer the exhale, the longer the parasympathetic system is engaged, which helps fight that cortisol response in your system. You don't have to rush the breath, you're just inhaling and exhaling, letting it flow. Great. If you don't have access to a breath pacer or computer, you can also use the second hand of a clock, which is something that we utilize a lot in patients' rooms. And again, with that tick, you want to try to breathe in for 5 seconds and out for 5 seconds. And just notice how your body feels. This is something that you can do in moments. It doesn't take a long time to do. You can also set up a structure for yourself. For example, I personally have a little sticker in my rearview mirror in my car, and every time I look in the rearview mirror, it's a cue for me to take a nice deep breath in and out. Sometimes we recommend that patients try this every time a commercial comes on or someone comes in their room, which could be quite often, so they're breathing a lot. Again, just becoming mindful of your breath can be the very first step to becoming a little less stressed in your life and improving your stress response.
Glad we have you here to
do
the technical stuff.
Happy to help. All right, there you go.
Perfect.
Good job.
All right. All right, so the next relaxation technique that we are going to talk a little bit about is something called guided imagery or visualization. And basically it's a technique that helps to purposefully guide our thoughts and beliefs into a desired outcome. So there's, again, a lot of research that has been done about guided imagery, and some of the specific things that it's been proven to help with are obviously stress management, pain relief, and then even some nausea in chemotherapy patients.
Okay. I was going to say, we know that the mind and body are absolutely connected, and so it's interesting how your mind can actually produce different effects on your nervous system and your body just by thinking those experiences, and we're going to get a chance to practice that in a few moments. There's lots of different resources for imagery and relaxation online. These are just a few that we have utilized to get resources for our patients, and that's why we chose them to put them here. But there are tons online that you can find. There's also on YouTube channels is what we actually used for the breath pacer. You can find different imagery, cues, and scripts that will lead you and guide you through relaxation, so that you can have someone to help guide you through those pieces.
So we're going to have you guys practice with us once more. Just so you know, I can see all of you that are watching right now, so I'm going to know if you're practicing with us or not on this piece.
I'm practicing.
So if you're comfortable, what we're going to have you do right now is just to allow your eyes to close. And just for this moment, I want you to picture yourself standing in your kitchen in front of your refrigerator, and you're going to open that refrigerator door and see a basket of lemons. You're going to reach in and grab one of those lemons and then close the door. You're going to feel the weight of that lemon in your hand. Notice the texture. You might even bring it up to your nose to see what it smells like. And then you're going to place it on the counter. And I want you to pick up a knife and slice into that lemon. And then once more, slice that half again. And then bring that quarter up to your mouth and take a big bite out of the lemon. All right. I'm going to have everybody open your eyes now. All right. So now tell me, you guys followed along with us on that one too. Did either of you notice anything when you did that quick little exercise?
I was going to let I was going to let Tim answer first.
Well, it really took my focus away from all the day-to-day things. A little too much, because then I had to think, is there anything I'm supposed to be doing here, any switching I need to do? But it really helped to dissipate the other things that were going on in my mind and place my focus on that experience.
I definitely noticed my mouth getting very watery.
Okay.
Because I was able to focus in that way, and so that was...
Absolutely.
Still, and I could almost smell that lemon. And, yeah.
So another lemon example. It's a short one, and but it's a good example of how what Kelly just talked about. She said she had basically a production of saliva, which is a physiological response within our bodies. So we didn't have an actual lemon here, but what we were doing was using our minds to generate the response that we were looking for inside of us. So that's a really good, quick example, I feel like, to make sure that we can see the connection between our mind and our body. If you think about, like, when you're in a situation where you typically feel good, like we often hear people talk about, I want to go to the beach, or I want to be in the mountains, or be in a certain place, when you're in a place that you enjoy being, typically your body feels well physically. When our hearts and our minds are experiencing, appreciation and love and joy and the things that we enjoy, our body has a physiological response to that. So I don't know if you have anything to add into.
Yeah, it's absolutely true. Our emotions have much to do with how our body responds to stress. And research shows and suggests that the feelings of appreciation and gratitude can be some of the strongest impacting emotions to feel, and re-experiencing those can actually help induce that same response in your system to help fight off the cortisol effects and the stress effects that we've experienced when you're overstressed.
All right.
Okay, so progressive muscle relaxation is another technique that reduces feelings of stress and anxiety, and it can also alleviate some tension. The other piece that does is activate the relaxation response that helps us combat the impacts of stress. The thing with progressive muscle relaxation that we really like is that it's a concrete experience. You don't have to try too hard in your mind to process information or use. So if you're someone that has a difficult time staying focused with guided imagery, progressive muscle relaxation might be a good technique to utilize. And it's essentially holding tension in progressive parts of your muscles, different muscle groups, and releasing that tension. When you're holding tension in those muscle groups, you want to try to hold that tension for about 5 to 10 seconds, and that progression will then move to different parts of your body, but eventually you also want to make sure that you're releasing that tension for about 15 to 20 seconds. It also gives you insight into recognizing the different tension that you're experiencing in your physical body and how relaxation feels. I know oftentimes when we practice this with different patients, they'll say, well, I did not know I was holding so much tension. So it's actually a really good technique to utilize in helping you become aware of tension and relaxation. Again, we often will guide patients through progressive muscle relaxation, but the other piece you can do is look on YouTube, and again, those resources that were previewed earlier can also give you some different resources to help look at getting CDs or things called playaways to help guide you through progressive muscle relaxation.
Absolutely. So switching gears a little bit, we're going to talk about exercise and the potential benefits to aid with your recovery and coping. I think there's, again, constantly research being done on the benefits of exercise in the oncology population. These are just some of the few benefits that we've seen. Obviously, lots of physiological benefit, the reduction in diarrhea, nausea, fatigue, improved endorphins within our body, an increased sense of control over our body, which can be huge for people as they are going through treatment. It allows the patient to feel like they are contributing to the treatment process because we know the physical benefits that one receives from being active. It may help with sleep patterns and really just an improved overall quality of life.
Again, Kelly's alluded to the research. There's tons of research out now on different ways that exercise helps with all different types of diagnoses, illness, prevention. But we also know that exercise can help immediate mood elevating effect. So exercise is a mood stabilizer, which can be very helpful in the terms of managing the stress. And so again, something that can be important to be aware of.
Does exercise help to fight cancer? Some of the studies have certainly shown that exercise does enhance the activity in our immune system, specifically with our killer cells, T cells, and obviously those will help with the cancer fighting proficiency. Some additional studies. In this particular one, it talks about how exercise can help with treatment-related fatigue. Obviously, our fatigue certainly has an impact on our emotional well-being when we feel like we can't do something, but obviously by knowing that exercise does help to combat that fatigue, that could serve as a motivator for someone to help make sure that they do keep moving. The next point on this particular slide talks about individuals that perform daily exercise during stem cell transplants. This particular study showed that those individuals had a shorter period of neutropenia, which for me, that's the primary area where I do work, so I'm acutely aware of, how important this is for these individuals. Even if it shortens their hospitalization by even 1 day, that is significant for them. And of course, many of the studies also indicate that moderate exercise reduces the infection risk in patients being treated for cancer as well.
So in thinking about,
there are barriers.
So we do know that there's barriers to different lifestyle changes, and so some of those include thinking about what is your personal experience with exercise prior to diagnosis or illness, or being a support person for a patient or family or caregiver person. What are your personal beliefs about exercise? And what's your past experience with exercise? So another thing to consider is how much have you been exercising prior to your cancer diagnosis. The other thing that can be a barrier is the energy. That can be limiting for many people's ability to have activity in their life, fatigue, time, and then resources. Another piece of where people can exercise and how to get a good exercise plan established.
Yeah. So we have some things listed here that may be helpful in keeping you motivated when you are working to use exercise as a technique to aid with managing your stress. One of the first things to consider is, the need to establish a personal goal. This is going to look very different from person to person because, as Kelly mentioned, we all start at different levels. Your own personal goal may be that you're going to walk to the mailbox once a day, honestly, depending on where you're at. For someone else, it may be they're going to walk 30 minutes a day, or for someone else, it could be they're going to maintain the current routine that they already have. But again, that's going to be different from person to person. It's really just important when you start to exercise to, to identify what your personal goal is going to be.
That's true. developing a routine can be very beneficial in helping you maintain motivation. And we know that getting a routine can help keep you with your goals. One of the things that's important about routine is if you've established a personal goal to do, say, 30 minutes of walking daily, and you're unable to maintain that because you have something coming up in your day, if you can still at least do that 5 minutes or even 8 minutes of that activity, you're more likely to maintain that as a habit, a healthy habit. So that's what research has shown us. So a lot of times people will have a routine established, and then for a moment they are not able to meet that routine for the day, and then we'll drop it altogether. So, but just know that it's actually okay to continue to do that, even if you have to modify that time for the day. You're more likely to be able to maintain it and continue with your goals that you established.
Finding a walking partner or an exercise partner can also make a big impact on your ability to stick with a program. I know even for me personally, for those of us, who are typically healthy and trying to just stay active, if I'm going to go to the gym, I'm much more likely to go if I know there's someone there waiting to meet me, or if I'm going to a specific class. If I have someone to hold me accountable, that's a really good way to maintain your own motivation. Keeping track of your progress is another way, because you're able to see, that you are moving forward. Sometimes when we're taking baby steps, it's hard to see our progress. So if you keep a progress journal or just sort of write down what you do from day to day, you're able to see that progress, which again can aid in maintaining your motivation. We tend to give the patients on our unit a walking log when they walk in the door, and we have some incentives in place, once they reach certain goals where we reward them and really enjoy that on the unit. But we also give them things to take home with them as well, to write down what their goals are going to be so they can continue that once they are out of here.
And keeping it comfortable is really important too. Wearing good shoes, appropriate clothing can all be helpful in maintaining your goals, and giving yourself that reward system. If you've maintained a goal and you're proud of yourself, go get a nice new pair of shoes or a nice shirt that helps you stay motivated and moving. And then we also use different tools and technology.
Absolutely. Yeah. So one of our favorites is the Fitbit. It's really nice because it gives you reminders throughout the day to get up, get moving. It helps you track your progress. We don't endorse these, by the way.
No, we don't.
I should have said that.
How many?
Disclaimer.
How many?
How many steps?
How many steps do you have, Kelly?
I'm winning. I'm not sure. Yeah, a lot.
Oh, wow.
I'm winning.
Yep. Okay.
So basically, the important thing is we've seen people get very creative in what keeps them motivated. I can think of patients that have even used like online games. I'm not familiar with Pokemon Go, but I had a patient who would get up each day because he knew if he would move around, he would be able to earn points or score, however that works. So basically, if you can find something that you enjoy and then that you like doing, you're more likely going to stay on track and meet those goals.
There's also things like Charity Miles and Runkeeper, different apps that you can earn credits for different charity donations that you would like to make in that way.
But just, certainly want to make sure that after diagnosis, you always want to speak with your physician and your treatment team to make sure that you are doing what is recommended for you in regards to exercise. And, of course, your activity level should never really exceed to what you were doing prior to your diagnosis.
Okay. So opportunity for social support. So social support is associated with how networking can be in our life, how it helps us during stressful events. And there's lots of different types of social support. There's actually a social support theory out there, but essentially we're looking at different things that can help us. We have different things like emotional support, which is sharing our experiences, sharing the feelings of love and empathy from people in our life. And then there's instrumental support, which these are like physical things that aid us in services that directly assist a person. And informational, these things may come from your doctors or from your other support people, different websites as well that suggest information a person may need to help manage some of their stressors. And then there's appraisal support. This comes from people where you are able to get useful self-evaluation tools. Therapists, counselors, chaplains, recreational therapists can all provide these as well. And we have a few here that we've listed that can be very helpful for our patients and caregivers.
Then the one thing I really like about these is I often hear caregivers say that a big challenge for them is trying to disseminate information about what's going on with the patient. And, by utilizing one of these resources or, sort of identifying someone that can be the point person for you or your family to disseminate information, that can really take a lot of burden off of the actual patient or the caregiver themselves.
I know sometimes people will utilize Facebook and get a new Facebook account so they can have friends be supportive during those times. You can even make up a fun name for that Facebook account and continue to keep up information and information sharing and also receiving positive support for that.
Just other various support options, and I know everybody tuning in is kind of from different places, but here at UNC we're very fortunate to have the Comprehensive Cancer Support Program, which essentially is made up of a team of professionals that help to support the emotional needs of patients while they're going through treatment. The Look Good, Feel Better program is a really nice option sponsored through the American Cancer Society. We offer that program here at UNC. I believe it's the third Monday of each month. But again, if you're tuning in from elsewhere, across North Carolina, I know this is offered in other places. So that's certainly something that you could look into.
Good. Move on to creative. Great. So creative expression is something that sometimes people have to get comfortable with, but there's all sorts of different mediums we can consider for creative expressions. From journaling, which is an opportunity for you to write about different experiences you're having, to artwork, which gives you a free flow, or it can be a structured flow of different things for expressing different emotions that sometimes you can't find words to describing. We also think about music, whether that's listening to music or whether that's playing music and creating music is another great way to soothe the soul. And dance and, of course, humor is another big piece for that.
So there's some of the benefits, just research related. You touched on a little bit about that already. So another outlet certainly is humor.
Knock, knock.
Who's there?
Interrupting cow.
Interrupting cow. Okay. All right. There's our fun moment for the day. Anyway, humor can certainly ease the mind, diffuse tension, and have a positive physiological effect on us. It can stimulate our organs, activates the stress response, and can soothe tension. And then some of the long-term benefits of utilizing humor is that it can actually improve your immune system, help to relieve pain, and just kind of increase personal satisfaction. So obviously knowing when to use humor is very appropriate as well. Make sure that you're mindful of that. There we go. Certainly music. I mean, there's lots of evidence also that music can certainly help many of the effects that we have or that people experience when going through treatment. This is one of my favorite pictures from some folks that we had on our unit a while back. Each of them in their normal life was involved with some type of music group. They had bands and played in different areas, and so for them coming together on a regular basis while going through treatment to play and do the things that brought them joy in their outside life was very helpful to helping them cope with their journey here. I mean, everybody can usually think of a time that you've gotten into the car or stepped in some place and a certain song has come on the radio, and it's automatically transported you to a certain place, certain time, doing something probably that you've enjoyed, maybe with friends or family. Okay. So, and then I'm going to lastly, what is legacy? So it's basically anything that's handed down from the past. Cancer diagnosis or not, legacy should be something that is important for all of us. Basically, it's something that kind of assists us and our families in sort of initiating the process of our life review that can, again, be passed down for generations to enjoy.
I know we actually, personally, we're involved in those things for ourselves.
Yeah.
And, I have a 3-year-old, and you have children too, and I've, for example, given some grandmother journaling and grandfather journaling to my daughter's grandparents for them to work on. So they have those as part of her legacy.
Absolutely. We've listed some of the things up there that we use most often here. Some of our favorites, this is just a book. It's actually called A Mother's Journal. You can find them for fathers, grandfathers, whoever. But it's really sort of a guided journal that asks questions about one's life and allows you to reflect on it. And so these are things that, again, like Kelly said, would be important for any of us to do, but a lot of times in our day-to-day life, we have a hard time finding the time to sit down and actually do them. So we encourage patients a lot of times in the hospital setting when they are here for many days on end or sitting in the, infusion center, for hours on end. This is something that they can do that, again, can be handed down to, their loved ones along the way, even with positive outcomes. Absolutely.
I think as we're talking about this, the word legacy can sometimes feel synonymous with death. And so one of the things that's really important is to recognize legacy as a part of connection with the family and with your friends if you're distant, and even also for other people and caretakers to continue to connect with people in their life that may be going through different diagnoses and treatment process.
Sure. A couple others just quickly. Another favorite is the recordable books. We encourage a lot of parents, grandparents again, or anyone that has young children at home to do this because it's able to capture the voice. And this is something that, if you're in the hospital setting, the patient can call home, have the child pick up the book and listen to the book. They can kind of listen together. Even once you're back home, if you have fatigue and just don't have the energy to sit and read or do whatever, you can at least sit with a child, open the book, and they can still hear your voice and make that connection. And we've got lots of others. But again, legacy work is not about death and dying. It's about life and living. And just a few tips as we wrap up. If someone is having a difficult time speaking, you can still assist them with these projects. Do something that involves writing or making something with their hands. If writing is a challenge, try the videos. And then if fatigue is an issue, always just enlist the help of others. And just a couple quick last-minute resources, that we can show you. And again, we hope that today's talk has certainly just kind of helped you to be more aware of, just in our everyday life, how stress can impact us and, some of the effects that it has on us, and the importance of making sure that we identify healthy coping techniques so that we can manage those feelings as well.
To echo off that, it's really difficult sometimes to even be aware of those things. So you can always return back to the symptom checklist and be aware of those components. And find resources within the community. The support networks can be helpful too. So thank you for joining us today.
Kelly Morelli and Kelly Kivett, thank you both so much. We have an opportunity to field a few questions before we wrap up. So if you haven't already, go ahead and join our Poll Everywhere by just going to Pollev. And you can. The easiest way to do that is just text 22333 with the letters UNCCN one time if you haven't already done that, and then we should see some questions pop up if you have any in just a minute or two here. So stress is something that we're going to deal with at various times in our life and throughout our life. Obviously, cancer is a very significant time of stress. When we get off track, you talked about routine and then maybe a particular episode or dealing with a particular medication. There are a lot of things that could throw you off track. What helps somebody get back into that routine again if something's really disrupted that? You're in a groove, it's working, and then something blindsides you, but how do you get back to that routine that may have been successful in the past?
I think one important thing is to know that that's going to happen. Just first of all, just knowing yourself that it's going to happen. As Kelly said to start with, we talk about this, we teach this, but we're not perfect ourselves. I think, but again, the awareness, just that, even if you have a plan in place, no plan is foolproof. And so I think first of all, just the awareness that things could change, and then
and then giving yourself permission to be okay with that. A lot of times when people fall off track from their goals, it's really easy to beat yourself up about that. But I think it's giving permission to know that that's going to happen, and then having support people to kind of pull that back in if they notice a behavior or something that has been something difficult for you. For example, increased isolation or withdrawal, that they're able to also kind of cue on those things too if you feel like you need additional support.
Yeah, good. Thank you. Let's see. All right, we've got a thank you that came up on the board. I would certainly echo that. Any other questions? Now would be the time to field those to Kelly Morelli and to Kelly Kivett. All right. I want to bounce ahead to our next presentation for just a moment. That's When Treatment Fails, Supporting Your Loved Ones During End-of-Life Care. And that's with Heidi Gessner, and she'll be here on March 31st, 2017 at noon. We hope that you're able to join us for that, and we hope that you'll spread the word about today's presentation, which will be online by tomorrow, as well as this and other upcoming presentations. We want to thank the generous support of the North Carolina General Assembly for funding the University Cancer Research Fund and the UNC Lineberger Comprehensive Cancer Center. Here at the UNC Cancer Network, Mary King, our operational coordinator, and Alan Brown, our continuing education specialist, are instrumental in making this lecture and all of our other lectures possible, so we want to thank them. We're on the web at unccn.org. You can find us there, find out about all the different events we have coming up, find our library of all past events, and you can watch any of those freely. I think we have well over 150 different recorded lectures now, and they're all carefully indexed. You can search every word of every piece of text on every page. There are lots of ways to find what you're looking for. You can call us, you can email us, find us on Facebook, find us on Twitter, and find us on YouTube. So lots of places to find out more. Kelly and Kelly, thank you both so much.
Thanks
This
for
has
having
been
us.
outstanding. We
Nice.
really appreciate
you.
it. All right. Thanks to everyone. Have a great afternoon. We look forward to seeing you soon. Thanks so much.
you.